Hi, my name is Jessica Drummond with the Integrative Women's Health Institute, and I'm thrilled to be here today with Laura Adler, our co-faculty and brilliant environmental toxins expert. On this webinar today, we'll be talking to you about how to expand your practice to work with women who desire healthy pregnancies, healthy babies, of course, and easier postpartum recovery. And this webinar is to introduce you to our upcoming course called Optimal Fertility. And it's a program about how to offer preconception detoxification and preparation programs to your community. So the best part about working with this population of women and couples who are excited about having their first babies or second babies or fifth babies is that it's really, generally speaking, a time of joy and a time of motivation. Now, we will be coming into contact in this population with women and couples who are very much struggling with infertility and challenges related to having difficult pregnancies in the past, having miscarriage and pregnancy loss in the past. But overall, the goal is something that's very joyful, and it is a time of significant motivation. So it's a great population to work with and be connected with. And we have a lot to offer for even those women and couples who are really struggling, which can really shift this time from a time of struggle to a time of joy and family expansion, and eventually all the sleepless nights and fun that go with that. So let me start by, this is Laura Adler, a beautiful picture of her right here, and I'm going to let her introduce herself. This program has 7 modules, and I'm thrilled to be joined by Laura because she is such a global expert on environmental toxins, and in this population, that is so important. So hi, Laura.
Hi, thanks, Jess. First I just want to say hi, everyone. I'm Laura Adler. I'm an environmental toxins expert, educator, also a holistic health coach. And, I've been working for the last 5-6 years really studying and researching the impact that environmental chemicals have on everything from fetal development, which we're going to be talking about in this course, to things like autism and allergies and weight gain and thyroid disorders and all of the health issues and maladies that we are dealing with in our current times. And I will say that, when Jessica approached me about this program, I immediately jumped and was like, yes, absolutely, because this audience of women who are stepping into either preconception planning or, like Jessica just said, having their first or second or third or fifth child, they really are the most vulnerable population when it comes to environmental health, and it's such an important audience. So I'm really, really excited to offer insights into the environmental health space as part of this program because it's so important.
Thank you. Thanks so much for being here, Laura. So, and then as I said in the beginning, I'm Jessica Drummond. If you don't know me already, I'm the founder and CEO of the Integrative Women's Health Institute, where we offer continuing education programs for physical therapists, health coaches, nutritionists, fitness professionals, and a wide variety of multidisciplinary clinicians focused on giving the best evidence-based integrative treatment to women across the globe. So I'm going to be talking with you on this program about the real nuts and bolts, the research behind the how to offer preconception detoxification programs that are safe and effective in this population. We'll talk about preconception nourishment, and we're going to dig into the perinatal microbiome because that has such consequences. As Laura said, this is a vulnerable population, not just the moms, which definitely their health is extremely important, but we're learning more and more about intrauterine programming, which simply means that the healthier that uterine environment is, we can think of it as almost a unique environment, the healthier that baby can be throughout its life. It can really set up long-term adult health for the fetuses and infants in the uterus. So in modules 6 and 7, we'll be bringing that depth of evidence and research and nuts and bolts, and giving you a lot of tools for specifically how to use this knowledge to talk with clients and patients in your practice in a way that's empowering and not paralyzing. And Laura is brilliant at that. And I will be also giving you Module 7, which is an entire look at skills, tools, and strategies for helping couples who know what to do. So now you've given them clinical recommendations for how to prepare that preconception body and health and environment, how to optimize their fertility. And coaching is really the bridge to not just knowing the information, but implementing it specifically in their lives, which has its own practical challenges, its own emotional challenges. So I'll give you a lot of tools there. So now we're going to talk about, I'm going to give, Laura and I are each going to talk through the modules that we'll be teaching on this course, but we want to be sure you get something out of today. Whether or not you join this program with us, we're going to teach you some things that you can use right this afternoon, tomorrow in your practice with this population, because probably you are seeing some of these clients already, and we want to give you some snippets of wisdom to integrate right away. So, as I said, the challenges and opportunities for reducing a perinatal woman's environmental toxin load is great. This is a vulnerable and motivated population. And we have a great opportunity to optimize her digestive health, her hormonal health, and her detoxification system. This program is designed to give you the evidence-based knowledge, so everything is research-based. This isn't just hype. And we want to, though, Laura and I both have lots of clinical experience, and we want to help you not only give them the book smarts, but give them the information that they're going to need to be able to actually use this in real life. You know, just because a woman's thinking about getting pregnant or she already is pregnant, she can't leave our environmentally toxic planet. You know, you can't just like go to an island somewhere that's not full of toxins. You still got to live in the world and not be paralyzed in fear. So that said, Laura, what are you going to want to share with them today that they can take back to their practice even tonight or tomorrow?
Well, I think what's really important to understand, one of the things that I'm such a huge fan of is contextualizing the conversation. This is something that is helpful for me to speak to you as the practitioner, but also for you to speak as a practitioner to your client base, to contextualize why you may be bringing up things like personal care products or household cleaning products, so that we understand why we are having this discussion. And part of that comes from contextualizing what is, or describing what is the landscape of chemical toxins in the world today. As Jessica just said, there is no non-toxic island that we can go to. Polar bears in the Arctic have levels of chemical flame retardants and all kinds of things. So there really is no, quote, safe place for us to live. We just live on Earth. And understanding the nature of this landscape can be really helpful for us in understanding the importance of doing this work and then imparting that same level of importance onto the clients and patients that you see. So to put this into perspective, what we're looking at here in this landscape is we have approximately 84,000 chemicals that are in use in the United States. Globally, it's a little bit higher number, around 100,000. Most of these chemicals, thanks to really poor federal policy and chemical regulation, not just here in the U.S., but in other places around the world, most of these chemicals are untested. They've not been tested for safety. Additionally, they've been tested, for the ones that have been tested, they're looking at really overt acute symptoms like hair loss or skin rashes or immediate increased risk of cancer. They're not looking at the really subtle, small markers of things that we are experiencing today, really creeping up rates of infertility, rates of autism increasing, learning disabilities, behavioral problems, allergies, gut disorders. All of these things are sort of slowly creeping up. And this is partly due to this landscape of these untested and in many cases very harmful chemicals that we are surrounded by every single day. Now, to put some of that number into perspective, the World Health Organization clearly states that 25% of global disease is actually caused by environmental exposures that can be averted. Emphasis on can be averted, right? So that's why we're doing this work. In the United States specifically, that accounts for 13% of all disease. When it comes to children, again, which is why I'm so glad that you're here listening to this and why this program is so important, World Health Organization states that 33% of disease in children under the age of 5 is caused by environmental exposures. Right? This is why it's so important that we're here and we're addressing this. Very recently, an opinion statement from the American College of Obstetricians and Gynecologists said reducing exposures to toxic environmental agents is a critical area of intervention for obstetricians, gynecologists, and other reproductive health care professionals. That is why we are here.
Oh, that's so important. So important.
Yeah. So, and just to also point out, environmental health is not a subject that is adequately addressed in any of the medical or health education practitioner programs out there. The average MD receives, over the course of his educational career, his or her educational career, only 7 hours in environmental health training, despite those World Health Organization statistics. So part of my mission in doing this work and having this conversation is to change that number so that more health practitioners are well-versed in the environmental health side of the conversation.
That's great. I'm so glad you're here because, having been to health graduate school in both physical therapy and in nutrition, really it's not something addressed there either while we're dealing with the same long-term chronic illnesses that can sometimes start in childhood. So let's talk about that now. Those teeny tiny doses, do they really matter?
Yeah, so this is actually one of my most favorite parts of this conversation because it's one of the ones that comes up the most in conversation with the general public, which is why I wanted to share it on this webinar, because as health practitioners, it's usually one of the first sort of knee-jerk responses that people will receive or practitioners receive when this conversation comes up with clients is, well, gee, I've been using these products for decades. I grew up using, Pearl shampoo or Pantene or whatever, and I'm okay. And the amount of chemicals in these products is so small they couldn't possibly matter. That also is the same defense that product manufacturers will often say is, well, but the amount of chemicals in these products is so small, it's go ahead, I'd like you to try to prove that my specific product has caused harm. And so the reason why there's layers to why this is so important, and one of which is children are not just small adults. So amazingly, people think that children are just small adults, and that's not the case. Even up until they're 5, 6, 7, their bodies are still developing. Neurodevelopment is still taking place. When they're in development, meaning in utero, they're incredibly sensitive to absolutely minute, infinitesimally small changes of hormones in the body. And so they are an extremely vulnerable population. They do not have the ability to detoxify in the same capacity as adults do. And so when we're thinking about dosage, we have to think about it a little bit differently when it comes to children. However, even when we're looking at it through the context of adults, we have to understand that low doses matter. And in fact, the entire fields of endocrinology and pharmacology are built upon the understanding that the body is actually designed to respond to compounds at extremely tiny doses, parts per trillion, parts per billion, parts per million. This is the dosage of most pharmaceutical medications delivered at those tiny doses, and we all know that they're effective. And in fact, we also all know that they come with a long list of side effects. If you watch American television, you've all seen the ads that are, if you have restless leg syndrome, take this medication. It might result in blindness or death, but at least your legs won't be restless.
Right.
So, those two fields, endocrinology and pharmacology, fully understand that these absolutely minute doses matter. However, the entire field of toxicology, which is what determines our regulatory status of these chemicals, does not acknowledge that that is the case, that these low doses matter. So there's a little bit of a warring in the sciences. However, again, the core thing to take away here is that these really small doses matter in significant ways. And in some cases, because of the way the body responds to these chemicals, a very tiny dose can actually cause a far more dramatic response than a large dose. So most of us are, like I said earlier, are looking for overt reactions, a rash, fever, vomiting, and sending someone to the emergency room. And that's not always the case. It can take a lifetime, can take 10, 20, or 30 years for symptoms to develop from this chronic low-dose exposure of chemicals that we're getting every day. So I really want to just impart that to you so that you know going out into the world to start having the conversation with clients that these tiny, tiny doses do matter. And it's not just one chemical that we are exposed to, it is hundreds of chemicals in tiny doses all day long that do add up and have the potential to cause some serious damage, which, as the World Health Organization said, can be averted.
Yes, can be averted, and that's the most important thing. We'll be focusing on that because there's so much that can actually be done, and not just from so Laura essentially will be supporting you to understand how to reduce that toxic load. And as we both have acknowledged, there is no place where there's going to be no toxic load. So what I'm going to try to explain, and I think is really important, because as she said, she always gets the question of, do small doses matter? I am always getting this question of, when is it safe to do a detox? Can you do one before pregnancy? Is it safe to do a detox during pregnancy? How quickly after pregnancy? What if you're still breastfeeding? And I think there's an inherent problem with that question, an inherent myth in that question. The problem is that your body, and every human body, and of course less so in the fetuses because they're not fully developed yet, but every human adult woman who's carrying a baby is constantly detoxifying, or she would be ill because we're constantly, or die because we are constantly being exposed to toxic chemicals. So the idea of quote unquote doing a detox is the wrong question. So there are two correct questions though within that are important. And number one is, it takes a lot of nutrition, it takes a lot of nutrients, a lot of amino acids, a lot of micronutrients, which are your vitamins and minerals, proteins, which break down to amino acids, to support even just the part of detoxification that happens in our liver. And detoxification actually happens not just in the liver, but in the lymph system, in the skin, in the lungs. Every cell and tissue has some ability to detoxify. So we want to be sure that your client has all of the nutrients that she needs to support those vital processes, because as Laura said, her infant, her fetus, doesn't have the capacity to detoxify in utero the same way she does. So her system is doing some of the work for that baby because she's living in the world and being exposed to things. But secondarily, there are times when we want to push that detox process. So as the body is being exposed to toxins, it's very smart, and it is really good at basically taking the toxins and hiding them in different places where they'll cause less damage. And that includes places like the bones and the fat cells. And so what we don't want to do, either just before, during, or while a woman is nursing or breastfeeding, we don't want to take all of those stored toxins out of hiding, because then they can pollute, for lack of a better word, the baby, the fetus, either the fetus internally in the uterus or through the breast milk. And so that's why preconception as its own phase is very important. And I think we need to start thinking of pregnancy in a longer term view. I started talking about my patients who were trying to recover postpartum and having them think about that as almost its own unique trimester. We divide pregnancy into the first, the second, and the third trimesters. And then pregnancy is like the fourth trimester. Of course, that doesn't make any sense exactly, but there's a whole separate time postpartum where a woman needs to recover. And that can take a while, especially if she's nursing. It can take several years. But now we also want to start thinking of this preconception phase, because that is a huge opportunity for supporting the mobilization of those toxins, getting them out of those hidden storage places, and supporting the body's detoxification system to excrete and eliminate them prior to the woman even trying to get pregnant. So that preconception phase ends at about 3 months prior to pregnancy, or ends when she's starting to actively try to conceive. And I think that we don't really acknowledge that as a phase of pregnancy, but I hope that through this program and through the work that all of you are doing, that we can add this to the lexicon, that there is actually a preconception phase where a woman and her husband, because it makes a difference, male health makes the same amount of difference. Both man and woman contribute the same amount of DNA. And when it comes to fertility, when it comes to the strength and health of the egg and the sperm, if we can have a nice phase of preconception where a woman and a man are focused on getting optimally healthy, there is so much benefit to that for them and for their developing baby right from the get-go. Sometimes you just simply don't know you're pregnant right away. So that will be the focus of that module. And then we'll transition to talking about not just excreting toxins, but women, about 25% of American women are on antidepressants, and about 80% of American women have been on birth control pills at some time. And so those are the two most common medications for women of childbearing age. And those two medications together deplete some of the most essential nutrients for supporting pregnancy. So not only do we want to support that woman to detoxify, we want to help her to really nourish each and every one of her cells so that she's got the strength, the capacity, the nutrients to build an entire other human being, or two human beings if she's having twins or more. So these nutrients, including folate, which is essential for preventing neural tube defects, vitamins B2, B6, and B12, which are essential for that detoxification process, among many other biochemical processes. Vitamins C and E, which are antioxidants, which again are supportive both for baby's growth, but also for keeping inflammation under control, which is part of keeping that intrauterine environment really optimal so the baby's not at risk in adulthood for things like obesity and type 2 diabetes. And other vital nutrients, including magnesium, selenium, which can prevent postpartum thyroid issues and postpartum depression, and zinc, which is important for digestive function. So if women are taking these medications at very high rates and they don't know that they're depleting them of vital nutrients, and these are just two medications, these are just two impacts. We've got a whole module on the ways that women who are pregnant or trying to become pregnant need to be nourished. And if they don't have the ability to restore those nutrients because either their digestive function is poor or they're not eating the right nutrition, then already that baby is set up at a disadvantage. And so is the mother, because the pregnancy can be more difficult. The postpartum recovery period can be more difficult. She's at higher risk for postpartum depression, and it can be a real struggle. And our goal here is to support women, couples, families, and babies to not just have a really healthy pregnancy, but to enjoy it as well, not be exhausted and sick. So then we'll transition into speaking in Module 8 a lot about the perinatal microbiome. This is a very hot topic in the research world right now in nutrition, and it's essential because pre and probiotics, so I'm sure you have heard of the gut microbiome, and that is a a whole community, a giant community. I actually heard a great quote about this the other day, that there are more bacteria in your colon than there are stars in the Milky Way. So the microbiome is that community of bacteria that live in our colon. But there is also a unique community of bacteria in our mouths, in the placenta, vaginal microbiome. There's actually a penile microbiome. So skin microbiome. So the healthier this community of bacteria that really support our health and support the health of the developing baby and kind of kicks off its ability to have a really strong immune system right from birth, is an important thing to understand when you're working with preconception, pregnant, and postpartum women, because there's a lot of, as we were talking about with the environmental toxins, there's a lot that can be done to really optimize the health of the perinatal microbiome. And the biggest question I get kind of day after day about this is, are probiotics safe for perinatal women and their babies? The easiest answer to that is yes. There are more than 30 published randomized controlled trials on prenatal probiotics and prebiotics in this population. There are nearly 40 published studies. The challenge that we'll dig into much more in the course is, which brand should I recommend? And this is a more complex question that depends a lot on the reason that you're recommending perinatal probiotics or preconception probiotics. Are we looking for diversity of bacteria in the vaginal canal? Are we trying to treat a vaginal infection? Are we trying to treat prenatal constipation or postpartum constipation, which are really common? It really depends on the reasons, and there are lots of different strategies for optimizing microbiome health, which we'll get into. We don't really have time for today. But I want to just leave you with the fact that you can't trust the marketing on probiotic supplement preparations, because just because something says it's the perfect prenatal probiotic, that may or may not be true according to the literature, and that may or may not be true according to your reason for using it in that specific client. So I want you to understand the detail, not just look for marketing. So we'll get deep into that in the course. So Laura, how do we talk toxins with our clients without scaring them?
That's such a big and important part of this whole conversation. I think that generally speaking, it's pretty fair to say that anybody in the preconception, pregnancy window, or even postpartum window is already dealing with a tremendous amount of overwhelm. It's just an overwhelming part of life. Women who are newly pregnant for the first time are going through a tremendous amount of changes. And so we don't want to, in our work with them, especially around the environmental toxins conversation or environmental health, we don't want to add to that overwhelm. We don't want to come sort of out of left field and say, okay, well, today we're going to talk about all these things that you're doing wrong and that are toxic for you and bad for you, and all the things you should be doing better. And I say that semi-jokingly because sometimes that is how it comes across. And so one of the things that I have learned in the years of doing this work is that how you approach the subject and how you bring this conversation up with people can make or break your success in being able to support them, and ultimately in their ability to even hear you, for them to hear what you're trying to say. And so some of that comes from the fact that many people approach the environmental toxins conversation with a fair amount of sensationalism. I'm sure that all of you have seen articles on Facebook or Huffington Post, or all different types of sort of general public publications that come off as being incredibly sensational. They are what I call chicken little sky is falling, everything is going to give you cancer kind of vibe. And so when the first sort of point that I want to make here is that when we come from that place of really sensationalizing or also soapboxing and preaching or proselytizing about all the things that people should be doing, it tends to fall very flat and people immediately shut down and they won't hear you. And if they can't hear you, then they are not going to be open to making the changes that we want them to make so that they can have these healthy children and healthy families. And so the way that we approach this subject really determines our success in getting and retaining not only the attention, but the participation of the client, meaning they're actively making these changes. And one of the ways that I teach people to approach this is to implement what I call, or create what I call bridges of relatability, meaning that you need to create a bridge between the information that you want to share and where people are actually at in their process. And so if you are coming out of left field and saying, okay, today in our session we're going to be talking about cleaning products, or I want to talk to you about your shampoo, clients might go, well, wait a second, I thought we were talking about preconception nutrition. Why are we now talking about my shampoo? That doesn't seem to make any sense. I don't get it. And they're not going to get on board with the conversation and the work. And so when you create, again, what I call this bridge of relatability, you are connecting the reason why they're working with you in the first place, meaning they want to have this really healthy pregnancy and a healthy child and a healthy family. And you want to connect that core reason of why they're coming to see you with this place that you want to take them. You want to take them over this bridge and say, hey, we're going to be talking about some things that seemingly might not have anything to do with growing a healthy baby or having a healthy pregnancy, but they are in fact directly related. And so I want to just spend some time talking about things in our personal environment that might be impacting the outcome of your healthy baby. And so just making a statement like that does start to create that bridge. You're setting up for them the reason why you're having this conversation. If you don't have a type of bridge of relatability, this just becomes something else that they have to worry about on their long list of things that they have to worry about. And so, I just think that we get into this far more in this module 6, I believe it is, the subtlety and the nuance of how to have this conversation so that we're not compounding the overwhelm that they're already experiencing. We're not compounding any stress. We're merely just talking them and guiding them through, here are some of the changes that we're going to be working on in our program or in our time together. And that makes such a huge difference in the way that people feel supported, so they don't feel like they're being judged or being told that they're doing all these things wrong. There's just subtlety and nuance. And so I think it's such an important part of our being able to bring this environmental health conversation into our practice that I, of course, wanted to make sure that we included it here in this program, because it can make or break your success. As I say, the messenger can kill the message. So that we want to make sure that the messenger, meaning your delivery, is spot on, so that you're really making the most of it. And part of that, and we get into this much further in that module, is how you leverage this information to expand your scope of practice or the work that you're doing from a marketing perspective, so that you can talk about in your marketing and your work that you are somebody who has training in the environmental health space and knows how to support your clients. Because as I said at the top of this webinar, most practitioners do not have training in this space. So it's a huge point of distinction and an opportunity to really leverage what you're going to learn in this course to expand your practice. So I'm excited to dive into that part.
Absolutely. Yeah, and similarly, so when we're offering nutrition information, when we're offering the data on probiotic strains, again, we're talking to a population that can potentially already be overwhelmed, already be a bit nervous, already trying to do the right things about so many different things, that when we talk about everything in this program, we want to really strengthen our coaching skills. Often we're going to be working with the woman herself, but sometimes we'll be working with couples, and we'll be communicating about relationship challenges. We'll be talking about stress reduction and shifting of stress. One of the most essential things in terms of the success of in vitro fertilization and other assistive reproductive technologies that you can really add to this population is shifting their relationship with stress, their relationship with the entire process. And not only does that make the process easier emotionally, but it physiologically enhances the success of that IVF or other assistive reproductive technology procedure. It actually enhances the likelihood that they're going to get pregnant, which is one of the key reasons that they're coming to see you. So how we talk to our clients is nearly as important as the information that we're sharing with them. And I'm going to give you a lot of tools. One of my favorite tools is called the family vision. And again, sometimes we're working with one member of the couple first, and that's perfectly fine. But when a couple comes together and really considers what they see as how, bringing this baby into the family is going to shift their work lives, their relationship lives, their relationships with their extended family and friends, and what are the real benefits of having a baby, and what are going to be the challenges, and can they come together working with the challenges? Because the more they can visualize the strengths that they have going into this major shift in their life, because again, even if it's not their first baby, anytime you add someone to your family, there are going to be shifts. And creating this kind of conversation with the couple can change an experience from significant stress to significant joy. And it's one of my most favorite parts of working with this population. Not only that, for those couples that are really struggling with infertility, it helps to solidify that they already are a family. No matter what happens with how they grow their family, if they end up having a child, with the assistance of reproductive technology, or they have natural conception, or they end up having adoption, or they end up having the two of them who maybe go out in the world and take care of other children or other people or just themselves in a different way, it helps to solidify the importance of the two of them as a family coming together no matter what the outcome is. And not only does that relieve stress and make the experience much easier for those who are struggling, but it actually enhances the likelihood that they can get pregnant in many cases. It depends on what the issue is. But these are important strategies, because if we come at our clients with too much overwhelming information without putting it into context and without meeting them where they are, they're not going to be able to implement as successfully as if you really are listening to your clients and building those bridges, as Laura mentioned. So these two modules are key pieces of the program for making your program successful, for marketing your program, for distinguishing yourself from any competitors. So the goal is to really support your practice with this program. You have so much to offer this population, and they're looking for you. Women and couples have a lot of questions, and sometimes it's just too scary to read everything on the internet, or to just, talk to their friends who are doing nothing but telling them their horror stories. You want to be that safe place that has the true evidence-based information, not a lot of, what were you saying, Laura, the Huffington Post kind of like everything's going to give you cancer articles, right?
And all of the mom blogs and the mom groups that are saying do this, do that, and every female relative coming out of the woodwork when you're pregnant to tell you how you should do it.
Yeah, and that can be really scary and really disempowering when you have actual, randomized controlled trials behind the information that you're sharing, actual scientific data, but also you've developed those skills of compassion and communication. You get to work with a population that is so much fun. It really will breathe new life into the practice that you have now. It can build a completely new niche for you, and it's a fun population to work with. So let me explain to you some of the specific nuts and bolts of what happens in this program. And if you've done an online training before or haven't, this is a 7-module program, which means that you are going to get 7 chunks of content delivered to your email box once a week, every Monday through the course of the 7 weeks. The first week starts the moment you register for the program, and the second week starts, about a week and a half after that, and continuing on every Monday. The good news is this program is available anywhere on earth. You don't have to buy a plane ticket. We are going to come right to your inbox. And so that is all recorded information in webinars such as these, and handouts, patient handouts, copies of the slides so you can follow along and take notes. Then Laura and I will be offering live calls where you can come and ask your questions, and we'll support you both with those research questions and science questions, but also we can talk about the communication piece as well, because it's just as vital. Additionally, we will give you admission to our private Facebook group through the Integrative Women's Health Institute, which is actually full of brilliant, leading edge women's health professionals from all over the world. We have at least 25 countries represented now, and all of our faculty are there. Laura and I will be there. So we have 24/7 support for you. We don't always answer you in the middle of the night, but we'll get to your question within the day or two after you ask it. And this is something that I think makes this program really unique. So at the Integrative Women's Health Institute, we offer continuing education for a wide variety of clinical disciplines in women's health. We have midwives, we have obstetrician gynecologists, we have physiatrists, we have physicians in a lot of different board certifications, we have physical therapists, nutritionists, health coaches, fitness professionals, massage therapists, and what we've done to really support you to actually take this program and implement it appropriately depending on your clinical discipline is created 4 toolkits. And these are specifically for physical therapists, nutritionists, fitness professionals, and health coaches. And if you are not among one of the other clearly defined at this point disciplines, and we may be adding more in the future, the health coach program is appropriate for any licensed or certified clinical discipline. So if you're a nurse midwife, if you're a physician, that's a good place to start. And we've given you all of the toolkits. So if you are a clinician who crosses disciplines, you can look and see using these guides how to implement this in your practice, no matter what your training is, because that can be confusing to sometimes go to a course that is offered to a number of disciplines and then try to implement it in your practice. We've made that very clear for you with these toolkits. And there are payment plans available for the program. So the complete details about exactly what's included in the program, the dates, the pricing, every frequently asked question we could think of, are listed on the page below this video. So go there and read the information. And Laura and I are so thrilled to meet you. We can't wait to meet you in the program. And all of the work that you're doing right now is really vital. And I want you to understand how vital a resource you are to the perinatal women in your community. I get calls from women every day, every week, who are looking for clinicians that have this knowledge and this compassionate and skilled communication and ability to really work with them. They need your support, even in a time where we have lots of information overload. So thank you so much for being here. Yeah.
I just want to interject that they definitely need your help around the environmental health front, because it is the Wild West in terms of information out there, and they are women and are left to the internet to try to figure out these problems for themselves. There are not enough people that are trained in this conversation, so they do need you on that front as well. And then that's again why I'm so excited that you're here, and that hopefully you will be part of this awesome program. So hope to see you guys on the inside.
Absolutely. Thank you so much, Laura. And Yes, you know how confusing it is as a clinician to try to find this information on the internet. So imagine the shoes that your patients and clients are in. This is your grand opportunity to pull it together for them in a way that feels much more empowering and much less scary. So thank you so much for being here, and we'll see you in the program. Bye.
Yummy and